A 15% cut is a lot. It's huge. There's been about 11% cut since 2002. So this is another 15% cut added on to that. The bill also changes to a health savings account for employees. That is going to be a salary cut, including for our own hardworking employees in the legislature, of about $13,000. Now, an AFSCME member makes on average $38,000 a year. A $12,000 to $14,000 pay cut is huge. And folks, if you have, like one of our staff does, a child that has diabetes, you're going to be paying huge deductibles before your health insurance is going to pay for anything. This isn't a plan that anybody should have. I understand some private firms have gone to this plan, and those employees have next to nothing for health care in reality. If you're healthy and you're 21, you're going to do just fine under this plan. You might even be able to save some money. If you have a family, or if you are a single person that has blood pressure problems or diabetes or cancer or anything like that, you are going to very possibly go bankrupt. I don't think we want that for our employees, and we don't want that for the hardworking people in the state. Minnesota right now ranks number 10 in the lowest number of state employees. There are 40 states, excuse me, I can't count anymore, 40 states that are higher than us in the number of state employees for 10,000 population, for each 10,000 population. We tie with Florida, with conservative Florida, for the number of state employees we have. This is another 15% cut. These employees don't just live in Minneapolis and St. Paul, although it'll have a great impact on the unemployment rate in Minneapolis and St. Paul as well. And folks will be out there competing with the people that are already out there trying to find a job. But it also affects Andover, Lino Lakes, Bloomington, Edina, Eden Prairie, Senator Perry's district will lose jobs. It is going to have a major impact on our economy and on our unemployment rate. And I don't think that's what we're here about. This is only one bill that's going to cut jobs. But this cuts an awful lot of jobs, some more, some less. The health care bill will be doing the same thing. We cannot afford to continue on this route in Minnesota and expect our state to run properly, and expect to do the things the citizens of the state expect us to do. That's asking an awful lot of folks. So what they're being asked for, all in all, is to, their collective bargaining rights are being taken away through a freeze, through us telling them what kind of health care they have to have in the private industry. They don't even have the benefit of going into a group plan if they go out and pick their own private plan, so they're not going to reach a savings off of that, although Senator Perry did change the bill so that the state pays a part of the premium. We checked out some of the premiums, and I don't have those numbers here yet, but I'll get them. And it's going to be still going to be a significant cost for employees. Maybe they can get a $20,000 deductible plan and be able to afford it, but that's going to be some of their cost as well. If they have any pre-existing conditions, they can be turned down and they can end up in MCHA. And MCHA is a very expensive way to go, very expensive. I've had constituents in my district that I've referred to MCHA and they call me back with the rates, and it's ridiculous. So that's really not an option. That's a further salary cut. So what we're doing is cutting their bargaining rights, cutting their salaries, and expecting them to do a whole lot more work, which we've already put on them in the last few years when we've been cutting the number of state employees as well. This is really this is unconscionable.